good morning, good afternoon, good evening, and welcome to our IASP PRF webinar. I'm Renee Chassie, IASP's Publications Manager, and today we are excited to bring you a webinar produced by IASP's Early Career Network titled How to Peer Review Pain Research. Today we will be hearing from Dr. Karen Davis from the University of Toronto in Ontario, Canada, Dr. David Yarnitsky from Rambam Medical Center in Haifa, Israel, and Harrison Hansford from Neuroscience Research Australia in New South Wales. The IASP PRF and Early Career Network are thankful for everyone who could join us today and remind you that today's webinar will be recorded and available for later viewing at IASP's Pain Education Resource Center. I'd also like to encourage our viewers to utilize Zoom's Q&A feature to ask any questions you may have during today's proceedings. At this time, I'd like to introduce Harrison Hansford. Harrison is an NHMRC postgraduate scholar completing his PhD at Neuroscience Research Australia and the School of Health Sciences at the University of New South Wales. His research focuses on understanding whether and for whom interventions for musculoskeletal conditions are safe and effective using big data. With that, I'd like to pass today's proceedings over to Harrison, and I look forward to hearing from everyone. Thank you.
Thanks, Renee. And yeah, it's a really big pleasure to be able to host what will hopefully be a wonderful webinar on how to peer review pain research. And this is something we've been cooking up in the Early Career Network. And I'm part of the education committee, which I will give a little bit of a plug for, has been a really great opportunity for me to be involved in because I get great opportunities like this. So I think the call to be involved in the ECN has just passed, but keep an eye out for it in the future. And today I'm very privileged to welcome Karen Davis and David Yarnitsky, who'll be talking about their role in peer reviewing and how you can peer review better for pain research. So Karen Davis is the Canada Research Chair in Acute and Chronic Pain Research. She's a senior scientist and division head at the Krembil Brain Institute and professor in the Department of Surgery and Institute of Medical Science at the University of Toronto. Dr. Davis has pioneered electrophysiological and brain imaging approaches to investigate mechanisms underlying pain, delineate brain plasticity associated with chronic pain, and individual factors that contribute to pain sensitivity and chronic pain treatment outcomes. Her concept of a dynamic pain connectome is being used to understand mechanisms of pain and analgesia and identify neuromarkers to develop personalized approaches to pain management. She's published more than 200 peer-reviewed papers with over 29,000 citations and a very impressive H-index of 90. Dr. Davis is also active in neuroethics and equity, diversity, and inclusion initiatives, and she was a Mayday Fellow, was inducted in the Johns Hopkins Society of Scholars, Canadian Academy of Health Sciences, and the Royal Society of Canada, served as the president of Canadian Pain Society, was a councillor of the IASP, and Dr. Davis is currently the editor-in-chief of Pain, which is the flagship journal of the IASP. And I'll also introduce David Yarnitsky, and David Yarnitsky is the founding and current editor-in-chief of Pain Reports. He serves as the chair of neurology at Rambam Health Care Campus and professor and head of the clinical neurophysiology laboratory at the Technion Faculty of Medicine in Haifa, Israel. His research interest is understanding how the nervous system processes pain using mainly psychophysical and neurophysiological tools. Professor Yarnitsky's lab explores the modulation of pain by ascending and descending pathways in healthy subjects and pain patients in a variety of clinical syndromes and how it can be used to improve pain alleviation. And I think that's enough of me talking, and I'll pass it over to Karen and David.
Hey, thank you very much, Harrison, for that introduction. And thank you to the Early Career Network and all the work behind the scenes that you and your team have been doing to make this happen. And thank you, of course, to ISP for supporting this webinar. And I'm thrilled to be here, as is, I'm sure, David, who I've known for many, many years. I should just apologize. My voice is not all there today. I'm a little under the weather, so bear with me. So Okay. Okay, so the purpose of the webinar, as you know, when you signed up, is to provide some practical advice on peer reviewing pain research. We're going to cover a number of topics, including how to be invited to peer review, what to do when you're invited, and critical skills for early career researchers on peer reviewing. So David Yarnitsky and I will kind of be a tag team going back and forth between some particulars that pertain to pain versus pain reports. There's a lot of overlap in general concepts that apply to both journals, but there are some things which are a little bit more specific to one journal or the other. So we're going to be a tag team today and go back and forth. So let me just first give you the overview of pain, and then Dr. Yarnitsky can talk about pain reports. So for pain, we publish 12 print issues per year, one a month, plus an annual supplement that from year to year covers a different theme. In the year of the World Congress, that theme is typically the Congress and papers written by the plenary speakers, and in the off year, we have the opportunity to use our supplement to address a different topic. Last year, we had a special supplement addressing the 50th anniversary of the ISP, and next year we're the journal Pain is celebrating our 50th anniversary. So look for all sorts of interesting activities and offerings in 2025. So all of our articles are also published online in addition to the print issue. And our journal is thought to be in the category of a hybrid open access journal. And this means that authors of papers can choose to publish with open access for a fee, or if they aren't opting for open access, then they would be publishing under the standard subscription model at no cost. Oops. Okay, so David, you want to take over for?
Yeah, so I'm happy to join you guys here, and thanks to the ISP and the early career people for putting this webinar together. So first thing I would like to explain the open access issue. Karen, if you can hit the so that we can see the items. Go ahead. Okay, so the idea about open access is that the payment is put on the author rather than on the reader. The basic idea is let taxpayers' money be used and be open to all. So instead of libraries paying for having the opportunity to see the articles paying to the publishers, we as authors will pay to the publishers. The publishers always make their profit from this, and everybody can see the article. So essentially, we are completely online. So all the articles in Pain Reports are online. So every article is published as soon as it is ready in the website. Once in 2 months, all the articles are lumped together into an issue. So we have 6 virtual issues per year. Next. The content, as said, is freely available to everybody. So if you're working through PubMed or anything, you just hit on the article and you get a full article readily for you to be read. I must emphasize that the charge is only paid after being accepted. You don't have to pay when you submit. We will do the whole process of peer review free of payment, and only when we accept the papers and the payment is due before the paper is published. Next. There's one big advantage here over the printed subscription-based articles, journals, in the fact that we don't have any limitation on the number of articles. So we are open to as many articles as can come in. Next. We also publish special issues. they are not timed, but come as the need comes up. Like we are nearly out finishing a special issue on fibromyalgia, which is a really timely issue. We are preparing one on epigenetics in pain, and we had several special issues published already. You can see them easily at the journal website. And one additional feature is the pain clinical updates. Some years ago, it used to be a printed letter to all the ISP members. It has been transferred to pain reports. We publish up to 6 years, up to 6 issues a year, articles a year. Some of them are dedicated to the global theme of the year, and some are on just timely topics that we find relevant to be published. These are actually the most seen articles in the journal. This is you, Colin.
Yeah, okay, thanks. So so that's a little overview of the two journals. The next topic is how to be invited to peer review. And this is more, this list is really more directed towards you all as early career researchers. So if you're, a long established researcher that is known to us, then we don't really have to think about this. But the question is, how do you kind of get into the system? So first of all, you have to think, do I have the minimum qualifications? Most of you probably do, but just to make it clear, whoops, right. Yes, so at minimum, we would like to have you have completed your PhD or your residency. So some of you are at the postdoc or early career stage, so that's fine. You should have published in the field as lead author. You could imagine when you submit your own papers to be peer reviewed, you want the people who are peer reviewing your paper to have, expertise in the area, but also kind of have a sense of what it is to publish a paper, have some experience behind that. So we'd like to see that you've actually published yourself as lead author. And typically for people to kind of start in the system, it's recommended that somebody who's quite established in the field and who has previously reviewed for pain or pain reports, just to let us know that you're somebody who they would recommend would make a good peer reviewer. So this could be your former or current mentor or collaborators or your colleagues, and they can tell us themselves. Sometimes what happens is we actually invite an established person to peer review, and they're not available, and so then they sometimes recommend a junior person in their place. So sometimes we hear about it that way. Otherwise, feel free to send your CV to the editorial office and tell us about your area of expertise, and we'll keep that in mind and let the section editors in that area know to keep kind of consider you for a paper that comes along in that area. So what to do when you're invited by a section editor? Well, what we'd love you to do is to actually accept the invitation, and you would do that on Editorial Manager, which is our online system to handle the manuscripts. You'd be assessing the paper and any supplemental materials on Editorial Manager. You conduct the review, and contact the journal office or the editor-in-chief to get approval if you want to consult an expert. So you might feel a bit reluctant early in your days doing reviews, and you might want to have maybe a former mentor oversee what you're doing, and that's typically fine. Just let us know if that's going to happen, because we'll want to check if there's any conflicts of interest and that sort of thing. And also, it's not a bad idea to have somebody more senior have a look at what you're writing, because sometimes you might be unsure about the tone of your review. You know that if you've received a review of any of your own papers, you right away are very sensitive, I'm sure, to the tone or the language. And so we want to make sure that we're respectful in our reviews. And also the level of detail of the review, knowing what's fixable, what's not. It's hard to know where the line is to make a decision when you're new at this. So it's not a bad idea to have somebody oversee what you're doing the first couple times you do this. But please note that this is all very confidential, so do not share it with anyone unless you've asked the office and the editor-in-chief if that person can kind of oversee this with you. Okay, it's very important to keep things confidential. It's also very important to submit your review in a timely fashion. And you yourself know, as authors of papers, every day that goes by, you're waiting, anxiously to find out, the result of your submission, and it's very frustrating to have things get delayed. So please submit your review on time. You'll be given a deadline, and if there's some extenuating circumstance that requires you to have more time, let us know. If it's a major problem, we might have to just switch to another reviewer at that point to make it fair to the authors. Now, if you don't want to accept the invitation you've been sent, you can reject the invitation to review. Again, please do that right away so that we can move on to find another reviewer, and that the authors then aren't waiting for their decision. If you have to reject the invitation for whatever reason, it's also helpful to suggest alternatives and also mention a reason for declining. So if, whether it's because of the timing, whether you feel it's not within your area of expertise or a conflict of interest, something like that, it's sometimes helpful to know that. Okay, critical skills for peer reviewing. David, did you want to go through these, or do you want me to keep going?
Well, if your throat is okay, you can keep going.
Okay, I'll keep going. Okay, I'll keep going. Okay, so everything I'm saying, and you'll notice at the top, the slides that say both pain and pain reports. These are factors which really are general and pertain to both our journals. Okay, so obviously we want people to review a paper who have knowledge of the field. So subject matter expertise is really important. Now, sometimes you might not have all of the expertise needed. So we often will get kind of a confidential comment sent to us from a reviewer saying, there's some aspect of, let's say, a statistical analysis that's really not my area of expertise. So please make sure that at least the other reviewer has that expertise. So that's fine, but just let us know. In general, though, you should be able to review the validity and the impact of most of the content of the paper. So we're talking about both the subject matter as well as the approach methodologically, technically, statistically. Okay. Also, it's important to keep in mind the big picture and have insight into what this submission might tell you, kind of from a broad perspective, and also the relevancy both to either to scientific knowledge or clinical practice, clinical translation, this sort of thing. Because what we're looking for in our journals is both good science, knowledge being added, but also relevancy. Also, it's important to have clear, respectful, and professional writing. So when you write a review, again, think about how you receive a review as an author. It's not helpful if the reviews that you receive are unclear. You're not quite sure what they're getting at. Some reviewers, they might ramble on and on about something very interesting, but then at the end of all this, you're thinking, okay, well, that's interesting, they're thinking out loud, but what is it that they want me to do, right? Or if they disagree with my concept or my approach and this sort of thing, are they, it has to be done in a respectful manner. So sometimes there's not one right way or wrong way to approach a study. If you think that there's something really wrong or they're off in their approach, there's a respectful way of saying that, right? So
I'd
be
like to add
respectful.
I'd
Yeah.
like to add a point here regarding the respectful issue. I find myself sometimes editing the review before sending it back to the author if the language was not kind enough. So try to be within the kind limits. The other point I want to add is when you make a soft rejection decision or recommendation, as Karen said before, there needs to be a direction for the authors of what they need to do in order to resubmit. I sometimes get reviews which are saying soft rejection, but they're not showing anything, so the authors will not know what they should do in order to be able to publish. So that's also an important point.
Yeah, I think, thanks, David. I think that those are really important issues, and I totally agree. And I do the same thing about sometimes I will edit a reviewer's comments. I mean, for the most part, I don't want to do that. I shouldn't be changing what a reviewer says, and I won't actually ever change what a reviewer writes, but I will remove sentences or phrases that I feel are disrespectful or maybe a personal attack. And also, we'll get to this in another point. I'll remove a comment where if a reviewer says, this paper should be accepted or this paper should be rejected. So those are editorial decisions and not to be put into the public or the comments that go back to the author. Okay. Okay. So yes, try to have your critical appraisal a balance with both the praise for positive aspects of the paper as well as obviously the criticisms. Keep in mind that we'll get into the statistics soon. A large number of papers that are submitted to our journals are not sent for review. They go through what's called a desk reject, an editorial reject. So that's either by the editor-in-chief or by the section editors. So the papers that we do send out for review already have kind of made it past a certain filtering. So we clearly think that there is a chance that paper might have something good to say and might have a chance at acceptance. So therefore, there's got to be something positive about the paper. And so it's nice to let the authors know that about these positive aspects. Sometimes an author will only getting negative comments sometimes won't realize that maybe overall the reviewer thought the paper was pretty good, except they need clarification on some either major or minor issues. But anyways, try to have a balanced approach. And it is good to separate major and minor issues. So our form that you fill in with your reviewer comments is not structured in that there isn't. I know some journals might have a structure, where you type into a box major or minor issues. Ours is free flowing, so you just type it in. But it's quite helpful for both the editorial evaluation as well as the authors to understand what are your major issues and what are minor issues. And minor issues often, you might have a list of typos or something to be fixed in figures or something like that, something that maybe isn't so critical. But it will help the authors and the editors know, what your overall sense is of the quality of the paper. And it is important to have suggestions for edits or additional work. So it's all too easy to just kind of criticize a bunch of things. But as an author, what you want to know is, okay, you disagree with that, or you think this wasn't the best way of doing things. What can I do to make it better, right? So provide some suggestions. And if additional work needs to be done, run additional experiments and that sort of thing, then note it as well. And as I said before, do not indicate within your comments that is sent to the authors anything about your sense about whether it should be accepted or rejected or that sort of thing. That we will show you comes in a confidential communication through the form that you have to fill in. And basically the idea is that it's the section editor and the editor-in-chief that decide about the decision, right? So, we may weigh the balance of different factors differently than an individual reviewer. So it would be very confusing for an author to receive, kind of indication of what the decision would be from the reviewers, because that's not their role. Okay. Now, do you want to speak to this?
Yeah, I
David?
just wanted to add that many journals today are allowing or actually demanding reviewers to express their names, and they publish it alongside with the journal. We are not there, but if you want to reveal your name, I'm okay with it. I don't know if Karen is okay with it, but for parent reports, it's okay to put your name at the end of your critique.
Yeah, for pain, we don't let reviewers reveal themselves, so I would be editing that out. Now that it's an interesting concept, and it's something that we would need to discuss at the editorial board to see if we would change our policy. But we've never had people reveal their name for a variety of reasons. So that's it's an interesting concept, and something for us to think about in the future. But for now, we're not doing that. Okay, so you might have heard me refer to section editors, and this might be a bit unknown for you as to how the journal is set up. So I'll first go through pain, and then David can go through pain reports. So in pain, we have various sections: clinical science, epidemiology, neurobiology, pain measurement and imaging, pharmacology, psychology, and then we have topical reviews and other kinds of reviews. It's not really a section. So basically, each type of study, whether it's clinical or any of these things, have a number of one or more section editors. So the way it works is when a paper comes in to pain, I first have a look at it. Some papers I reject and not send out to the section editor, but otherwise I would then assign a paper to be handled by one of these section editors, depending on the type of study that they are, and also keeping in mind things like conflicts of interest, because one of the reasons we have multiple people in these sections is, a lot of people work together, right? So, we have to pay a lot of attention to conflicts of interest. So those are the sections, and for the most part, the section editors then are tasked with first deciding if they do want to send it out for review. If they don't, then they would communicate with me that they want to desk reject it. They'll give me some reasons, and then I'll either agree and send out that decision, or have a discussion with them about whether maybe to change that decision. But for the most part, then they would send it out for review. They'd be identifying a bunch of reviewers, and the invitations would go out. When the reviews would come back in, then it's their task to evaluate the reviewers that come in, the two reviews that come in, and then come up to kind of a consensus decision that then they convey to me, which I look at and evaluate myself and either concur or have a conversation with them about perhaps changing that decision for one reason or another. Okay, David?
So our section editors did not want to be identified on the writing as to their specific fields, so that they feel more free in their work. I can give you a short listing. So Simon is basic, Claudia Campbell is psychology, Alan Finity takes pediatric pain, Peter Garris is basic, Lian Cohn clinical, Javier clinical, Chung Moon psychology, Christian Peterson measurement and mechanisms, Heike Rittner does the pain clinical update, Nuj is clinical, Andrea is clinical, and Irit is imaging. One more difference in that relation between pain reports and pain is the fact that in pain reports, we have headings for each article. So it'll be the subfield like neuropathic pain or perioperative, and we have the type of articles, that is review, original papers, and so on.
Okay. Okay, thanks, David. Okay, so just so you get a sense of what kind of goes on behind the scenes, I won't go through all these details, but for pain, just to know that we currently reject without review. So this is what we're referring to as desk rejections, either myself or the section editor, about half the papers. This is showing 1,300 papers in 2023. I can tell you that we're already over 1,400 in 2024, and we're still in October. So you could imagine the issue of sheer volume of being able to properly look at each paper, evaluate each paper, not exhaust the pool of reviewers that are out there. You could imagine the task if we were to review every paper, and if we're only going to in the end accept just over 20% of the papers, it's actually to the benefit of the authors that if there's not a high likelihood that the paper will get accepted in the end, we feel it's to their advantage to let them know within a few days that the paper is not going to go out for review, so they have a chance to go to another journal and not be sitting around, waiting. As an author myself, it's frustrating. Sometimes I sit around waiting weeks and weeks and weeks, only to find out the paper didn't go out for review, and so that's a big delay. So that's just to give you a sense of the numbers for pain. For pain reports, David?
So pain reports is a much younger journal than pain. We are at volume 919 now, considering that it takes about 6-7 years to receive an impact factor. All the initial years of the journal we had to get authors to send us articles without having the impact factor and having to pay. Therefore, the numbers are substantially lower. So last year we had about 231 articles submitted. Rejection without review is about 1/3. In this graph, I want to show you the change that happens at the moment that we received our first impact factors. This is the arrow in the middle of the columns. So these are the number of submissions per quarter, and we received the impact factor at end of June last year, and you can see a double and even triple rate increase in submissions since then. We are having a hard time with the time to review because we have so many submissions and because we are not as known as pain, and many reviewers think, and I would not like to refute it, but many people think that if they are not receiving or agreeing to review, they get a black point of their name at the editorial office. So people are kind of afraid to refuse at pain, but feel more freely to decline a review for us. Nevertheless, maybe Karen will not agree with that. But we have hard time getting reviews, but eventually we do, and it's a major issue for now for us to shorten the times. The acceptance rate is currently a little less than half.
So just a little bit more about this idea of the editorial rejection or desk reject. Oops, okay. Just so you know, this is not just something that Payne and Payne Reports does. Is quite common for major journals. And in general, you will find that the highest, I know impact factors term that people don't like to talk about, but the higher the impact factor generally have the highest amount of desk rejects. So they're being journals are being more selective, both in terms of trying to keep a high bar for quality, but also to have a selection because there's a limit to how much you can publish, basically. But we feel that it's a largely positive system, as I said, timely answers so that the authors can move on and submit their paper to a different journal. As I said, about half the papers to Payne are desk rejected, and a lot from Payne Reports as well. Some of the common reasons is either the overall quality of the work, the likelihood that it will make an impact and be of interest to the readership of the journal. Oh,
For
yeah,
Payne
go
Reports,
ahead.
we have about, thanks, we have about
Yeah.
1/3 of rejections, and common reasons for rejections are the following. Quite similar to Payne: quality, novelty, relevance. That is, the paper is about Payne and not paper about something else where Payne is a corner in the paper, and globality. Payne Reports is by definition a journal for the whole world, with an emphasis of being a journal for the whole world. But I will not take articles that deal with a financial system of pain compensation in a certain country, as it does not have any implication on other countries in the world. So these articles should go to local journals. We do take articles for studies done in Asia, Latin America, and these places, as long as there is enough interesting new stuff for people in other parts of the world.
Great. Okay, some of the key elements for reviewing, again, consistent for both journals, is that almost all accepted papers undergo at least one round of peer review. So it is almost unheard of to have a paper accepted right off the bat. So peer review is critically important for the journals. For Payne, what we're looking for in a submission is that the study should be scientifically significant, methodologically rigorous, and a substantial contribution to the literature, so providing new insight and knowledge. So that's what, as a reviewer, that's what you should be looking for as well.
And I think we are not much different again. Let me see what is written there. So again, as I said before, relevance, innovation, methodology, and I'd like to add the excitement. I mean, I want to be excited when I get a paper and feel that there's something new there. You could put a camera next to me and see my face when a paper comes that is really, wow, this is new thing, I'm excited about it. Many papers are kind of more of the same, which is also important, but a little more exciting. So this is an important point for me. And another feature of the journal as a younger and less established, let's say, is that we will take a kind of high-risk paper. So in the case that the results are not completely clear, or the methodology is not completely foolproof, but we still think there's a new issue there, there's an interesting issue there, we will consider taking it, as things that more established journals will not. And any other point there? Yeah, case reports. As opposed to Payne, we do publish case reports. but it needs to be a case of substantial innovation and substantial significance, so that it teaches the clinicians amongst us something new that they didn't know. If you just did a certain treatment to a disease, which is a cousin of another disease, which for that treatment is already established, this is not a thing that we would like to publish. But if you have used something completely new or describe something completely not described before, we might consider. Thanks.
Okay, great. So now just an overview of what the process is. So we start off with an evaluation. As we've said before, the paper comes in, the editor-in-chief will evaluate the paper, and so we might desk reject it at that point. If not, we assign it to a section editor. Section editor evaluates it again to decide whether they should desk reject it or send it for review. If it goes for review, they're seeking to find 2 reviews. If those 2 reviews are kind of a split decision, then they might seek a third review to try to look at the balance of opinions. And then the section editor will make a recommendation, and based on reviews and their own expertise in the field, they'll convey to the editor-in-chief the final decision. And then the editor-in-chief will decide whether or not there should be a major revision, a medium revision, or a minor revision, or whether to reject the paper or provide something called a soft reject decision. In a soft reject decision, we're rejecting the paper, but telling the authors that if you do a substantial amount of work, in many cases this requires collecting more data or doing kind of a completely different analysis or something pretty major, then they can resubmit it, and it will be going through the evaluation all over again, often going back to the original two reviewers. But the decision about these different levels of reject or revision also come with it. I'm not sure, David, if this is the same pain reports, but for pain, you're given a specific amount of time. So sometimes, somebody might say, oh, why did they say it was a major revision and not a minor revision? Well, sometimes I first of all want to send a message that they need to take these comments very seriously. So I'm designating it major, but also they get more time to do the revision and submit it than a minor decision designation.
Yeah, we do the same.
Okay, so as a reviewer, what are your tasks then? On the editorial manager system, there's a form, and you'll have to fill out a variety of questions on that form. So one is provide a rating. So they'll be asking you for an overall rating about quality and the priority for pain or pain reports. You'll be asked whether or not you think that if the revision, whether the paper would eventually be acceptable if they revised the paper based on your comments. So would your rating significantly improve if the paper was adequately revised? Will the paper be acceptable after revision? This helps me as an editor-in-chief to know. I mean, there are some people that give a bunch of suggestions for the authors to improve the paper. But the bottom line is the reviewer might think that, even if you did all those things, sure, that would make the paper much, much better, but I still don't think it would be acceptable because maybe I'm just not very excited about it, or it's not very novel. But here are the things that would make it a stronger paper, maybe for another journal. So this is something that, as a reviewer, I find it very compelling to have this information in addition to the actual review. We also ask the reviewers to make a note if they think that this is appropriate for commentary, and would you like to write it yourself, or would you suggest other people? So if you think it's a very topical paper. And then so those first 3 bullet points are all confidential comments for the editor-in-chief to see. And then in the box where you have to give your comments to the actual authors, that's where you kind of cut and paste in what you would like the author to see. So then in terms of the category of recommendation, there's 3, as I said. If you think it's should be revised, medium, minor, or major, or reject. Again, the hard reject means that there's no it's called reject, but in essence, it's a hard reject, meaning that there's no chance for resubmission. The soft reject that David and I have been mentioning is where usually there's an issue that a lot has to be done, collecting more data, this sort of thing, reanalyzing in a very, very major way, and they would like to then send a message that we're not just going to look at a small little revision, do all these things and then resubmit it, and then we'll reevaluate it. And then the third category for pain is if and this is something that the section editor and I decide is whether or not if we have a hard reject, that we might want to transfer it to pain reports. So we might think that for a variety of reasons that it just doesn't fit pain, but it might be a nice paper for pain reports. The issues about that is still kind of up in the air. I mean, it's not that we want to send pain reports, papers that we don't think have a high enough quality for pain, because obviously we want to keep the quality of pain reports as high as possible. But there are some situations in which we think that pain reports, might evaluate it in a slightly different way, especially because they're maybe looking at things which are a little bit more high risk, something like that.
Only we are really running out of time. Maybe we.
Oh, okay.
For
Okay,
the
and accept is
Q&As.
the last one.
Yeah.
Okay. So why do we reject? I think this is almost the last slide. If the paper is irrelevant, if it's a small part of a study or technical paper on remote issues, minimal innovation, there are methodological issues, and minimal advance. So you're going to all get these slides, so you can look at the details after. And cascades, as I said, we can talk about this in the Q&A about transferring papers from pain to pain reports. Yeah, and that was it. Yeah, thank you.
Great. Thank you, Karen and David. I learned a hell of a lot. And I think I've heard you both talk, or at least Karen talk about peer review before. So it's good to keep getting more. There's plenty of questions in the chat, and I'll just start with one from Laura, who said, if you declined a peer review multiple times in a row due to a busy schedule or different reasons, might that lead to being blacklisted or not being invited again in the future? Or is it a blank slate each time?
Okay, for me, we don't have a blacklist. So there's no connection between if you declined and the papers that you submit. Section editors will note somebody that does consecutively decline and will not send anymore. That's a miss for the reviewer, because getting to do a review is always a very teaching procedure.
Yeah, similar for me. Like we don't have like a blacklist or a do not send list, but we do keep statistics on every single potential reviewer and author in the editorial manager system. So if, let's say, a section editor is trying to get a really quick third review because the process has already been dragged out quite a long time, and they have a bunch of people in their mind that they might ask. If they go and look at the statistics and they see, oh, we've sent this person 10 papers and they've not accepted any, they might be reluctant to send them this one in that situation in which they need to quickly find a reviewer.
Great. And then another one from Matthew. So if Payne rejects it and suggests a transfer to Payne Reports, does it then go out to another peer review, or is it just, the peer reviews go to Payne Reports and they make a decision?
So there's two kinds of cascades. One cascade is a desk rejection, so it comes to us without any review. So if it's not desk rejected by Payne Reports, it'll go for review. The other way is the articles that had been reviewed and we received the reviews from Payne. This is up to the section editor. If they're happy with the reviews and think they can go ahead and ask for revision or anything else, or if they're not happy and want to ask for new reviewers. I might add that in that regard, if we get a review without a name, because the author said, the reviewer said to Payne, don't pass my name further, it's a little less likely that we will rely on that review because we need to know who wrote it.
Cool, that's good to know. And then we've got one from Mulugeta, which I'm going to have to summarize because it's a little bit long. But essentially, they've gone to submit a paper about a cross-cultural validation in Ethiopia of a patient-reported outcome. And it got rejected, saying the paper it may not be in the interest of the general readership of the audience. I think that touched on a comment you talked about having global relevance. But his question is, how do you encourage and ensure equitable opportunities for authors from low and middle income countries to publish in Payne?
Colin? They ask
Okay,
about Payne.
Yeah, can you, Harrison, can you say that again, the last phrase? How?
Yeah, of course. So how do you encourage and ensure equitable opportunities for authors from low and middle income countries to publish in Payne or Payne Reports, I guess?
Yeah, so I mean, this is something that we're very aware of and concerned and want to find ways to encourage people globally to submit, regardless of their geographic situation, their financial situation, and this sort of thing. At the end of the day, we do have to maintain quality, but we can help people if they write to us. For instance, sometimes a study is done really well, but the writing is quite poor if English is not their first language. So there are ways we can advise them to get some help that way. The other thing is trying to give some feedback about how to frame your paper and make it accessible to people and make it exciting for people, right? So, we can help people in that aspect. And I'm actually quite interested, and I'm sure David is as well, in doing, a future webinar for people from low and middle income countries to try to address some of their challenges. It would be good to know what their challenges are. Clearly, there are some situations in which their situation kind of precludes them from doing, let's say, a very extensive study with a high sample size and the sorts of things that we're normally looking at. So they may not really be able to get to the type of study that would kind of qualify for Payne, but maybe there's other aspects of their study that they could pull out that could be very, very interesting. But they do need to frame it as David said, so that it is of interest to people outside of that particular environment. That doesn't mean that it just has to be of interest to people more broadly. And so we can, if somebody writes to me, and I can help them that way, but it might be something to address in a future webinar for sure.
Okay, we have discount on the fee for low and middle income countries, and I also have a few an option to publish a few papers without paying a fee, and I usually reserve it for these kind of submissions. The one thing that I saw people in the low middle income countries do is write reviews and meta-analysis and things that don't require lots of money to do the research. You only need your brain and your computer. And otherwise, people publish simple clinical studies, like use of a specific new medication in a new situation or something like that. And we do kind of lower a little bit our requirements when we have a paper from Egypt or Nigeria or Iran, or even I got from Pakistan, from Nepal. Many countries will do so. We do publish every here and there papers from these countries.
Yeah, that's a good couple of good points that David brought up. The issue about fees. So you know, if you don't want to go open access, then it doesn't cost anything to publish in paid. So, and if you do want to go open access and there's a financial issue, then you should write to us and we could see what we can do. For the approach of using doing meta-analyses and things like this, this is really, we get a lot of papers now from different countries that perhaps don't have the ability to run their own studies, but they're using all sorts of very large databases, international databases, and they're running a lot of studies. So we're seeing a huge number of papers coming in from countries that are taking that opportunity. The problem is most of them are very poor quality, and the actual paper might be done well, but they're not. They're kind of like, just because the data is out there, they're just asking questions which sometimes aren't very relevant or interesting. You know, you can correlate anything with anything, sort of thing, right? So I think I would suggest that people think very carefully first about, you know, the question you want to ask, and then you know, if you can answer that question with this database, not the other way around, that, oh, we have this big database, a global database, you know, we can data mine it for anything. So I think that's a bit of a warning in that area.
Great. I think that answers it really well. And I'll definitely start planning that future webinar for low and middle income countries and rope you in. So thank you. We've probably got time for one more question. And that is, in this ever-changing world of technology, do you apply AI tools at any point in the peer review process, or I guess the editorial process at all? And if yes, are there any issues that process presents or might present?
My short answer is don't do it. I feel quite strongly about that. I think it's a slippery slope. Everybody needs to be responsible for what they're doing. Sure, if somebody who's, you know, English is not their first language and they might want to use some tool to, you know, translate or to make the writing a little bit more professional, there, I suppose in some situations that might work out well. But at the end of the day, you're responsible for things. So as things go right now, I would say do not use these tools for this purpose.
All discussions in the associations of the medical editors, I don't know that they came up already with some kind of a solid policy on that. So this is kind of relatively open. But I agree that we want the people to write the science right now.
So there, I have to say that sure, you know, people keep showing me, you know, examples of ChatGPT and things like that, and you know, sometimes they're mediocre, or sometimes a little bit better, but a review needs to be 100% clear and correct. And there's nuance to a review. There's emphasis in a review, and sometimes you're also quoting other papers, all of which are things that should come only from, you know, the mind and the hand of the reviewer. Otherwise, there could be problems with that sort of detail and nuance, intricacy. And quite frankly, as a reviewer, if you want to be a reviewer because you care about the science and you are trying to learn something, and then you should be doing this yourself, basically. Otherwise, it's not serving you any good.
Great. Well, I just want to thank you both again, Karen and David, for this. I think, I've taken away a lot, and it's been really, really informative. And so thank you very much. And thank you for everyone to coming along. And the recording will be available later in the week, hopefully, and you'll be able to look back at it anytime.
Thanks very much.
Thank you, everyone. We've
Thank you,
come to
guys.
the conclusion of our webinar, How to Peer Review Pain Research. I want to thank again Karen, David, and Harrison for being here today, as well as Dr. Gregory Carbonetti for his help coordinating this event. As a reminder, the recording of today's webinar will be available on IASP's Pain Education Resource Center, and we encourage all of our IASP members to explore the other offerings there. We'll be back on November 4th at 10 a.m. U.S. Eastern Time for our next webinar, co-produced by the Musculoskeletal Pain Special Interest Group and Osteoarthritis Society Research International, titled Pain and Osteoarthritis. If you're interested, please register for the event on IASP's Pain Education Resource Center. Thank you all for your participation today. Take care and have a lovely rest of your day.